My name is Dan Elliott, and I practice sports medicine. I'm board certified in sports medicine, family medicine, and osteopathic manipulation, and I practice at Albemarle Orthopedics. The majority of musculoskeletal orthopedic injuries that come into my office don't need surgery, such as tendonitis, overuse injuries, arthritis, and even fractures. It's very rare to have an orthopedic injury that needs surgery immediately. As patients come into my office, I need to identify where the problem is and then what are the appropriate steps to try to amplify or maximize the body's ability to heal itself. Tendonitis can be described either acute or chronic in nature. A lot of times acute tendonitis is you start some new activity where you decide to paint the fence and then the next morning you wake up and you can't move your elbow. That's an acute condition versus chronic where it's a repetitive overuse. You're a manual laborer and over time your body just cannot take that repetitive stress and the tendon becomes inflamed, irritated initially and then becomes thickened and almost like scar tissue develops. Arthritis is one of the most common things that comes into my office, and really the definition that I give patients is it's wear and tear of the joint. Cartilage wears down, the joint space narrows, bone spurs develop, the joint gets stiff, and their function is affected. Muscles get weak, their range of motion is diminished, and they have continued problems. Another common type of injury that I see in my office is overuse injuries, and that's seen a lot in the athletic population, such as long distance runners, high school athletes, college athletes. And the nature of that condition is that they just keep pushing themselves and pushing themselves, especially with long distance runners. I think if we stay in good shape, keep our weight under control, stay healthy, exercise, do resistant training to help keep the muscle strong around joints, I think that helps prevent that, inevitable progression of joint wear and tear. And from my perspective, when symptoms get to the point where it's preventing that activity, that's where I come into play, where I can help control those symptoms with injections, topical therapy, physical therapy, bracing, medications, and just overall encouragement in healthy living. I appreciate being part of Albemarle Health System. It's like a family that knows its community, knows its patients, and knows its doctors.